Assalamu alaikum warahmatullahi wabarakatuh. Welcome to the 9 p.m. English News Edition. Here are the top stories. Chinese experts and doctors are continuing their tour across the country and working with their Djibouti counterparts. More than 7 billion euro for coronavirus vaccine in the worldwide. Hello, welcome to our newsroom for having the news in details. Prime Minister Abdul Qadir Kamil shared this morning the meeting of the steering committee in charge of implementation of the national response plan to COVID-19 pandemic. In addition to the Prime Minister, several ministers participated in the meeting, which took place at the moment our country is moving to a new strategy to launch against COVID-19 with the launch of a mass test at the national level and an extension of the containment until May 8, 2020. The prevalences of the pandemic was also discussed during the meeting, which was attended by Minister of Health, Mr. Mohamed Ouassama, the Minister of Interior, Mr. Mohamed Hassan Ahmed Sheikh, the Secretary of State for Decentralization, Mohamed Hamadou Aramis in Aden, the Ministry of Social Affairs, Mrs. Muna Osman Aden, the Ministry of Waqf, Mr. Mohamed Hassan Barre, and the senior health officials of the country and the presidency. Discussion focused on priorities, ways and measures to prepare a better progressive approach for the containment in the future if the trend in COVID-19 remains low. Now, another subject concerning the data of COVID-19 in Djibouti this Tuesday, 5th May 2020, 156 tests were performed, 4 cases positive to COVID-19 and 32 cases cured. After more than a month of epidemics, the balance is as follows: 378 tests were performed. This is the description of Dr. Salah Bunaita Turab. 1,120 positive cases, 745 are confirmed. Cured with the prior to death, the situation of the day is in line with the stabilization of number of positive cases. This shows once again that the healthcare center is doing a remarkable job, which should be congratulated both in terms of the early detection of cases and the search of contact person. Remain vigilant and respect all the measures that have been taken. And now a team composed of Chinese experts went to Al Sabih region. On their arrival the team was welcomed by the prefect of Al Sabih region, Mr. Musa Adam Sugi, and the general director of the regional hospital, Ahmed Absi of Al Sabih, Mr. Mohamed Sugi Ainan. It should be recalled that this team, led by the advisor of the Minister of Health, Mr. Abdul Qadir Mohamed Garad, is composed of specialists in infectiology, respiratory problems, and experts in the field of epidemiology. After the prefecture, the team went to the regional hospital of Al Sabih, where they were received for a working and exchange meeting by the medical manager of the regional hospital. At the meeting, senior medical officials from Al Sabih Hospital presented their activities in responding to the coronavirus pandemic to their Chinese counterparts. Chinese medical experts shared their experiences on the treatment of COVID-19. They also answered various questions on the prevention and control of the epidemic, detection of the virus, and treatment of patients. The head of the Chinese delegation, Dr. Zheng Yong, stressed in his speech that his team is ready to share their experiences to save more patients and to contribute to the fight against the pandemic. And now the survey on the prevalence of COVID-19 pandemic in Djibouti city is ongoing. Today it was the turn of Arehbat city to welcome the agents and investigator of the Ministry of Health. These were preceded by nasal and oral swabs and sputum collection. The survey will cover the entire population over 6 years of age in the city of Djibouti. 1,500 households with a total of 7,200 individuals. The result of this survey will provide policy makers with the factual, epidemiological, and statistical basis for the management of the national response plan against COVID-19. This survey will enable the government to assess the impact of containment on the dynamics of the disease, particularly on the level of community transmission. Also, as part of the humanitarian and social response to COVID-19 pandemic and during the Ramadan period in Djibouti, the Minister of Social Affairs and Solidarity, in collaboration with the Islamic NGO Muslim World League, distributed food ration. Indeed, this morning, nearly 350 vulnerable households living in Talabo district on the outskirts of Balbala received basic foodstuffs consisting of flour, rice, sugar, and other basic necessities. Most of these beneficiaries are widows, vulnerable people with many children, thus providing them with food support during this period. Faced with the increasing number of emergencies, the social workers of the mass are doing everything possible to continue their mission in the service of the most vulnerable people and are mobilizing every day to help the most destitute. Today it is more necessary than ever to support and help the most destitute. For his part, the technical advisor to the Ministry of Social Affairs and Solidarity, Mr. Mahmoud Bile Ali, expressed his thanks to the World Islamic League for providing this assistance to poor families in the Talabo districts and outskirts of Balbala. He said that this NGO actively accompanies the government's effort to alleviate the suffering of families in difficult situations through numerous charitable projects, particularly the project of the distribution of foodstuffs and the alleviation of consequences of the drought in Djibouti and the interior region. This aid, which includes basic food projects, comes during the blessed months of Ramadan and will help improve the living condition of the groups affected due to the containment in the cope with coronavirus epidemic, said the Minister of Social Affairs and Solidarity Assistant Mr. Mahmoud Bile Ali. Very recently, the Gendarmerie National publicly committed itself to supporting the efforts of the Ministry of Health in the fight against the COVID-19 pandemic in our territory. As part of the massive screening campaign undertaken by the Ministry of Health, the National Gendarmerie provided assistance to facilitate the work of healthcare personnel in the performance of their duty. With this in mind, on 4th May 2020, at dawn, the Chief of Staff of the National Gendarmerie mobilized about 20 of the institution's vehicles as well as about 100 gendarmes to escort and secure the actions of healthcare personnel in the various districts of the commune of Balbala. In the neighborhood, the gendarmes were in charge of opening the way for doctors and nurses by raising awareness among the population on the advantage of this massive screening campaign for the future of our country. More than 450 households in the commune of Balbala were visited, homes in which the occupants volunteered to participate in the screening campaign. The operations will continue during the day of May 5th, 2020, the date on which the massive screening campaign in the capital ends. The High Command of Gendarmerie reiterates its permanent commitment and availability for any request from the health services. It also wishes to thank the inhabitants of the commune of Balbala for their warm welcome and their sense of citizenship, which enabled the healthcare and care staff and the gendarmes to work in the best conditions. Moving now on the international news, it's an international race but without a competitor. In 2 hours, the initiative of the European Commission, the international community pledged 7.4 billion euros to fund and produce a vaccine against COVID-19, but these announcements are only a first step, and says the President of the Commission, the second objective is to bring all health organizations together under the same roof to work on initiatives to combat the pandemic, says Ursula von der Leyen. These financial pledges come from all over the world and will serve a threefold effort. They will enable research and developments of vaccines, treatment, and tests. Hundreds of laboratories around the world are working on a vaccine, but only the strongest cases will be eligible for this financial support. The vaccine could be available in 12 months at the latest. Additional funds will be needed to make its price accessible to the poorest country. This is it for this edition. Thank you for watching us and have a wonderful afternoon, wonderful night.